Hey guys, welcome to another session on FMT. Today we'll discuss a very important topic, that is autopsy, particularly medico-legal autopsy. So at the end of this session, you should be able to describe and discuss autopsy procedures, including postmortem examination, different types of autopsies, aims and objectives of postmortem examination. Describe the legal requirements to conduct postmortem examination and procedures to conduct medico-legal postmortem examination. Describe and discuss obscure autopsy. So let's begin with a case study. A 53-year-old male was admitted in the ICU with complaints of chest pain and fever. He had a previous history of myocardial infarction. After 2 days, the patient died due to cardiorespiratory arrest. While analyzing the case history of the patient, the physician suspected myocarditis instead of myocardial infarction as a cause of his death. He wanted to have an autopsy done for correct diagnosis, that is, what was the cause of his death. Now the questions that are asked here, whether this is a medico-legal autopsy or clinical autopsy, whether consent of relative is required in this case, whether a complete autopsy or a partial autopsy is sufficient in this case. Now some definition, what is meant by autopsy? It is a systematic examination of a dead person for medical, legal and or scientific purposes. This term autops means self and opis means view, to see for oneself. The synonyms for autopsy are necropsy, which means necrops, dead, opis, view, and postmortem examination, which means post, after, and mortem, death. So after death, you are examining the body. What are the types of autopsy? There are 3 types. First is academic, which is a dissection which is carried out by students of anatomy that you may have done in your first MBBS. Pathological or clinical, done by pathologists to diagnose the cause of death. To confirm a diagnosis, consent of next of kin is required in this case. So consent is required in case of pathological or clinical autopsy. For medico-legal autopsy, it is a scientific examination of a dead body carried out under the laws of the state for the protection of rights of citizen, and consent is not needed. In case of medico-legal autopsy, it is a state who is giving the consent. So for medico-legal autopsy, consent is not required. There is a term called virtual autopsy or virtuopsy or digital autopsy, which is in which the CT scan or MRI is used to detect the cause of death. So it is a non-invasive procedure using imaging techniques. What is the purpose or objectives of doing an autopsy? To identify the deceased in case of an unidentified body, to determine the cause of death, whether natural or unnatural, the manner of death, whether accidental, suicidal or homicidal, identify the poison, if it is a case of poisoning, weapon responsible for his death, approximate time of death and age of injuries. In case of fatal wounding, to determine the volitional activity possible after such trauma, whether he could move to that place or not, whether he could call that person after receiving that trauma. So that sometimes is asked to the doctor. In case of newborns, to determine the question of live birth and viability of the baby. In case of mutilated or skeletal remains, to determine if they are human, and if human, whether they belong to one or more than one person, the probable cause of death and time since death. So this is how an autopsy room should be, modern autopsy room. It should be neat and clean, and it should be spacious with the regular supply of water, and bio-waste should be disposed properly with adequate lighting source. The body is brought for autopsy. So contaminated zone, non-contaminated zone, they should be separate. You can do a postmortem X-ray before you take the body for an autopsy in case there are suspected fracture or in case of gunshot injury to locate it. The weighing of the body is done before the autopsy. The autopsy wear, what you should be wearing, the gowns, PPE, scrub suits, N95 mask is always preferable, surgical masks, gloves, 2 pairs you should be wearing, shoe covers, clear plastic shields. So these are essential requirement for an autopsy surgeon. Requirements and procedure before you proceed with the autopsy. In every case, the autopsy must be complete. That is, all the body cavities should be open and every organ must be examined. In case of medico-legal autopsy, it is a must that you are examining all the 3 body cavities: skull, the chest, the abdomen, and all the organs are examined properly. Authorization conducted only when there is an official order authorizing the autopsy from the police or the magistrate. All registered medical practitioners in government service can conduct the examination. No unauthorized person should be present at the autopsy. Doctor should remove the organs himself. The attendant should prepare the body and help the doctor where required, such as sewing the skull, cap, reconstruct the body, etc. But the doctor should conduct the autopsy himself. As the autopsy is proceeded with, details of the examination should be taken down verbatim by an assistant. Even if the body is decomposed, autopsy should be performed as certain important lesions may still be found, like a bullet may be found. Fracture you'll be able to find in even in a decomposed body. Should be performed as soon as possible after receiving the requisition without undue delay. Requisition is accompanied with a copy of the inquest, a dead body challan, which includes the name, age, sex, identification marks, and religion of the deceased, apparent cause of death, and any other paper of importance. Before starting the autopsy, the doctor should go through the inquest report and the requisition thoroughly, and you should put your signature all these papers as well as date. It should be conducted in a daylight as far as possible, because color changes such as jaundice, changes in bruise, and postmortem staining cannot be appreciated in artificial light. However, nighttime postmortem examination has been carried out in several states where there is infrastructure and lighting. Even a recent government order states that the postmortem examination should be conducted as and when necessary to harvest the organ for organ transplantation. Identification: the police officer or any other authorized person and 2 relatives should identify the body and in front of the autopsy surgeon. You should make sure that you are not doing an autopsy for which the paper has not been submitted. So there's mix-up of the dead bodies. Name of those who identify the body must be recorded. In unidentified dead bodies, the marks of identification, race, religion, sex, age, dental formula, photographs, and fingerprints should be taken. Medico-legal autopsy does not require any consent of the relatives of the deceased, as we have already discussed. So, no consent is required for a medico-legal autopsy. Nothing should be erased and all alterations should be initialed in the report. So, if you are making any changes in the report, this alteration should be cut with a single line and you should put your signature. The chain of evidence should be maintained. It is absolutely essential to preserve the chain of evidence by identifying the body and maintaining absolute control of specimen removed at autopsy. The list of articles: a list is made of all the articles removed from the body, like clothes, jewelry, bullets. They're labeled, sealed, and mentioned in the report and handed over to the police constable after obtaining a receipt. The chain of evidence should be maintained. Whenever you are preserving an evidence, it should be labeled, the number, the autopsy number, the CR number, it should be mentioned and handed over to the constable after taking his or her signature. After completion of the autopsy, the body is stitched, washed, and restored to the best possible cosmetic appearance and then handed over to the police constable or the IO. The body is not handed over to the relatives, but the police constable or the IO, investigating officer. Now, for autopsy, what are the basic or essential instruments that you should be having? They are required. They may be asked in your viva sometimes, in your NEET examination also. You should be able to identify the autopsy instruments. So now I'll show you a video demonstrating the same. The autopsy instruments. The most essential is a scalpel with a disposable blade. So it will be invariably requiring a scalpel. Then we have a scissor for opening the hollow organs and trimming of the tissues. So any form, it may be curved, it may be straight. Forceps to hold the skin. It's a pointed one, you can see. It's a toothed forceps which has got tooth and a blunt end. It is useful to hold the bullets also. If it is curved artery forceps can be useful for preservation of viscera when you tie the stomach on both the ends. It's an enterotome to cut the hollow intestine, for opening up the intestines. Enterotome. It's a brain knife. Smooth cutting of the solid organs with this instrument. One is sharp. This is a bone saw or the hacksaw. Bone saw, hacksaw. Serrated edges cutting the skull. This is a councilman rib shear for cutting through the ribs, and small pruning shear. It's a small pruning shear. It's a Dayanand rib shear, again to cut the ribs, and has curved blades. It's a probe to find the direction of the stab wound or the firearm entry wound. We can use it. Retractor to retract the organs during dissection. It's a right angle retractor. This is the hammer with the hook. You can use it with chisel when to remove the upper part of the skull. It's a hammer with chisel. So when the skull is cut with a saw, then you can use it to remove the upper part with this hammer and chisel. And you can have additionally you can have a digital camera, the ruler, scale, that can be added to your list of instruments. These are the basic instruments that you should be having to conduct the autopsy. One more instrument which was not shown is the striker autopsy saw or the vibrating saw. It is used to open the skull cap, and it is quite useful. It is easier also because the bone saw or the hacksaw that you have seen, it is a time consuming one, and it generates aerosol. It may cause infection also, but this one is very helpful. It is faster rate and opens the skull within few minutes. So striker autopsy saw or striker saw. Now for an image based MCQ, it is a higher order MCQ. You can see that identify the instrument, but the options given are A, Gage-Stell rib shear, Dayanand rib shear, C is councilman rib shear, and D is Gluck rib shear. So they are all rib shears. So you should be knowing the rib shears to answer this question. So what will be the answer here? Let's check. Gage-Stell rib shear. It's a angulated rib shear sort of thing like this, with the blade here in there. So it is not angulated one. So this option is incorrect. In councilman rib shear, we have already seen it has got a long handle and a small pruning end. So councilman rib shear, it is also not correct. Gluck rib shear, it has got like this like this. So it is also not correct. So Dayanand rib shear, we have seen that the instrument is Dayanand rib shear. The answer will be B. Okay.